And this webinar is going to be from idea to funded study, and basically really how they support you and as a health and social care SME to succeed further. So we've got the agenda here just to give you a little bit of brief outline, which I know you've all been sent in advance, so hopefully you've got all that. And as Sandra mentioned, we've got an interactive session with the Q&A with a poll towards the end, so we'll launch that, so please look out of that in the chat. So I'm Claire Ansett, I'm the operations manager for SATA. I recognise obviously quite a few familiar names in the on the list, so most of you are probably going to be very aware of SATA. For those that aren't members, SATA stands for the Science and Engineering Health Technologies Alliance, and we were formed 21 years ago, and we're a global networking agency, networking organisation of just over 1,200 members, obviously not just UK, but across the world. And we do foster relationships between universities, clinicians and SMEs. Like it mentions, we're not for profit, and we're here to support you as the members. And we do that by providing one-to-one support and one-to-many like this. So as I mentioned, we're no global network of 1,200 members. And for the last 21 years, we've really been here to support SMEs with commercialisation, look at how you can raise funds to support your organisation, and that's through working with organisations like Innovate, SBRI, NIHR. We've got a whole commercialisation team, and all those details are very clearly on our website. If anybody needs any support with funding, grant writing, looking at grant reviews, you've made a grant, you need it reviewed, then come to us and we can certainly help you. One of the attractiveness is that SATA is a registered RTO, registered trade organisation with Innovate UK, and with that you can apply for the RTO funding. It has changed the parameters of acceptance this year, but it's always worth just getting in touch with us if you're looking to create a set of commercialisation reports that you need to use for further funding opportunities. And it's a nice little grant, but like I said, the process and approval has changed slightly, so it's still worth getting in touch, and you never know what we might be able to do for you. So that's pretty much us in a nutshell. I won't go too long because I want Dawn to go into her slides, but all the information's there on our website, so you've obviously come through to the website to register, but just contact us at info@sata.co.uk and you'll come directly to me. So it's my pleasure now to hand over to Dawn Musgrave, who is the Strategic Lead for Industry at NIHR Research Support Service. So over to you, Dawn, and let you take control.
Thank you. Hi, everybody. So I'm at the Research Support Service, the RSS, which is part of the NIHR infrastructure programmes. So one of 15 programmes. So the Research Support Service is very much around research, as it says, methodologies around developing your research evidence. And I'm just going to go into a presentation of how we support SMEs. Obviously, we work way wider than just industry, and my specific focus is around SMEs, but we work with early career researchers through the NIHR Academy. We work with obviously HEIs, NHS trusts, etc. So it isn't just SMEs, but that's my particular focus. So I'm just going to run through a very informal session. So any questions, anything you want to know, just put it in the chat. And we'll be running through a poll as well, just to kind of make it interactive and just get some feedback from you, what would be helpful and supportive. So an overview of the NIHR, just in terms of where we sit. So that's my details there. So nationally, I'm the Strategic Industry Director, and then I'm lead as well for Newcastle and Partners RSS. So just to place things there. So we help SMEs turn evidence and user insights into fundable, adoptable health innovations. So we work across the NIHR applications. So for industry SMEs, that would be the Project Development Award under the I4I brand, and FAST. So funding at the speed of translation. And then latterly, so I'm thinking most people have seen the launch of the Innovation Catalyst, which is a pilot funding programme under NIHR. So literally hot off the press. So I think it was formally launched kind of the 9th of June, so from DHSC. So that's kind of a later addition to the funding suite for NIHR. We also work across Innovate, so we supported on biomedical catalyst funding, women in innovation funding applications as well. So we give practical help with trial design, health economics, PPIE, so public patient involvement and engagement, and we have a specialist around inclusivity, and also we specialise in plain English, which sits with the NIHR funding applications. There's specifically a section on plain English, and we have a team that can support on that. So quick offers of what we provide and what you'll get. So we can book in one-to-one advisory meeting to scope your application, your research design. So that's our specific specialism. So it's all about research design and methods. Specialist reviews. So we triage out to the team. So the team includes health economics, clinical trials, stats, trial design, PPIE. We run application workshops and writing retreats, and I'll give you some examples of those in a second. And we also signpost to other delivery networks and partner hubs. So because the NIHR has a vast amount, an array of programs, we work very closely in a one NIHR style. So we signpost, refer on with the health tech research centres, the research delivery networks, etc. So if it's appropriate, so if we've had a meeting with you and we think it's appropriate to signpost on, then we very much actively do that. And then also we signpost out to the wider health and life sciences ecosystem. So it might be the health innovation networks, or it might be pure business support advisors through the growth hubs, or through BIPC if there's specific IP support you need. So we signpost within the sector and out of the sector in terms of generic business support as well. So this is an example of an application retreat. So this is a very new pilot. So we ran one in April for Project Development Awards, so I4I, NIHR I4I, and it was a combined one with Innovate and biomedical catalyst funding. So that's kind of an example of what we cover on that. So working through funding streams, defining projects, looking at knowledge mobilisation, because that's an integral part of NIHR funding. Project management, so how do you illustrate that your project team's robust, and how you're going to convert your application into a project plan. So how do you develop your Gantt chart and your project team? And then looking at commercialisation, including touching on IP. Obviously, we don't specialise in IP, but we do light touch in terms of NIHR requirements around your IP. And then we look at market competitiveness, because obviously it's innovation funding. So is your product innovative? Is it novel? How do you differentiate yourself? How do you research into that market competitiveness to make sure that you have got unique selling points? Risks and mitigation. So how do you illustrate that you've mitigated your risks that you've outlined within your project? And then impact and value, so value for money, return on investment, etc. And then how you bring it all together. So we've developed resources and materials around this that can support the application. So that's an example of a retreat. And then also we've been delivering 90-minute online workshop application sessions. So ran one for fast funding, and we also ran one for the new innovation catalyst. So a very quick summary top line of what you need to include. So making sure that people understand kind of the key questions that are covered, success factors around TRL, readiness and policy alignment. So the whole principle is that it's interactive. It's around guided drafting. So there are built-in reflective sessions for people to start drafting up content for their applications, and then support around how you refine that. So people leave with some draft content and areas that they need to focus on going forward, and a development plan following that as well. So it's really, really important that people contact us early. So we've had, I'm going to say, hundreds of requests without exaggerating for application reviews for the new Catalyst, Innovation Catalyst funding. But obviously resources are limited across all of the hubs. And we need to have people already in the system. So we have an outline of who you are, what you do, what your concept is, what your needs are, so that we can support you. And if you're just come in a day or so, which I've had, a day or so before an application deadline, we aren't going to be able to help. So for me, it's not about just joining the RSS support ecosystem. It's about getting in early so you can start drafting up an application ready for future funding streams and future funding calls. Leaving it to last minute when a funding call's been announced and it's open, there's a very slim chance that you're going to get an application review because of the volume of approaches and resources as well. So we ask that people contact us early, and then we'll triage out and arrange specialist input. So people might come in and say that they specifically need health economic support, they might need PPIE support, and we'll signpost that out, internally signpost across the team, and a meeting will be booked in. So part of that initial meeting is around signposting to other ecosystem partners and stakeholders. So for example, the HINs, and we can review applications and suggest draft editing. But again, going back to the point that booking in's essential. So we also support submission and post-award planning in collaboration with any other NIHR programs, e.g. the HRCs, and we have a very close working relationship with the HRCs. So specialist areas that we cover: health economics, so modelling up and your value case examples, clinical trials and stats. So most RSSs are based with clinical trials units. So for example, Newcastle, our RSS director is also clinical trials director, and that's kind of normal model across the RSSs. So most are based with a CTU. So the CTU and the stats team. So we have distinct stats teams across the RSS that we signpost out to. So around design, and then the stats looking at your sample sizes, etc. PPI and inclusivity. So we've got for example, in Newcastle, so each hub will have their own PPIE team, but just kind of live example, because I'm based at Newcastle, so we've got a team of 5 that cover PPIE, inclusivity, plain English. And we can therefore give plain English support in how you do a clear lay summary and how you communicate it out as well. So just some quick case studies. So for example, this is Imperial RSS case study. So the RSS Imperial RSS supported a commercial academic team to secure 2.1 mil I4I PTA award, and helped in terms of the application review and clinical trials advice and support. So across the hubs, so there are 8 RSS hubs, so we're all national but just coexist within an HEI and a clinical trials additional support, but we all cover national, and most of the hubs are generic support, but we do have 2 specialist centres. One is for public health and one is for social care. So across the whole of the network, so I'll call the network 10 because I'm including the specialist centres. We've developed PDA support, BMC support, and Innovates Women in Innovation applications as well. And then obviously the new NIHR Innovation Catalyst. So the retreat that we ran last week in Newcastle, we had 15 delegates receiving one-to-one support within the retreat because it's facilitated. And the London retreat on Monday, we had 40 delegates that received one-to-one support. And also facilitators, so key facilitators on the table to support with that as well. So how CETA can help small businesses. So it's important for the SMEs to contact early, join workshops or drop-in clinics, sharing needs and common barriers, and we'll look at a poll. So we've covered the support models. So we're now going to move on to a interactive section looking at what your needs are, what your gaps are in terms of getting support, and how we could further help you as well. So Sandra's going.
Hi Dawn, before we do that, you've got a question from MJ. I didn't know if you wanted to answer that before we do the poll.
Oh yeah, no, for sure. I can't see because I'm in the slides, I can't see the Q&A. So
do you want me to read it out?
Yeah, that'd be great. Thank you.
Okay. So MJ is asking, when an opportunity comes to market, there is a short time to mobilise to deliver the application. Do you have an internal time frame requirements that we need to consider?
So it goes back to the point about getting in months in advance. So what I was saying at the retreat on Monday is having a content ready application in your bottom drawer, top shelf, etc. And whatever location you're going to use, obviously it'll be cloud or digital. but having that content scoped out, ready to tweak for a funding call theme is mission critical. So starting to scope out a draft application and then literally tweaking it for the call, but having it ready so you've got that resource ready is really, really mission critical in terms of business development and your business plan and commercialization plan. For me, if I was looking at NIHR funding, I'd look at the domestic funding application and literally start drafting that up around my product. And then when a call comes out, whether it's PTA, and whether it would be for new innovation catalyst funding calls, then at least you've got that up and ready and you can start working on that. And if you had that, that would be really helpful in terms of getting your support from the RSS, and we would be able to directly support you in your application development. Obviously, we don't create applications for people. That's not our role. We don't write applications, but we'll support in terms of making sure that your research design is clear and you've really thought things through. So just going into the poll, and then we can maybe quick pick up any Q&A at the end. So more than happy just to have an open forum in terms of any questions that you've got. That I can respond to in a Q&A session at the end, but it'd be really helpful just to get some interaction and some supports that we can use to influence our funding support offer and how we support you. So in one word, what is your biggest barrier to getting health and social care funding?
If you can type your answers where it says enter your response on the poll box, and then we'll move on. Once you've done it, we'll move on to question 2. If you click on the right arrow where it says 1 of 6, it should move you on to the next question.
Thanks, Sandra. I was thinking I couldn't see anything come up. Right, hopefully people have thought about that one. The second question is what would be the most helpful? So given that we have specialisms around health economics, trials, stats, PPIE, inclusivity and plain English, which would be the most helpful in terms of specialist support? So I'm not including industry support in that's kind of a given, but just in terms of us triaging out across the teams, what would be the most helpful for us to triage out? And just looking at the events that we deliver, what would be the most helpful format? Would it be workshop format? So like the 90-minute one I demonstrated. Would it be a drop-in clinic? So previously I've hosted myself out of one of the, well, not one of them, but a number of universities, commercialization suites. Would it be helpful in certain locations? What would be helpful in terms of drop-in clinics? Do you like the application retreat kind of format that I demonstrated? So that one day with interactive content and then giving you the space. That's why it's called a retreat, giving you the space to start drafting up your application, but in a supported environment. Would it be webinars? So some of the content from the retreats we've stripped out and we'll be delivering in webinars. So there'll be one on Friday, which is around PPIE, what you need to include in terms of your research evidence, or one-to-one, what would be the best format for you to get support. So I'd say the one-to-one's got a caveat, because that's going to be like really limited in terms of the volume of requests. So it might appear to be the best solution, but that is a caveat that I'm going to say before you choose that. What
Can I just add in there, Dawn? Just for everybody, when you're doing the poll, make sure that when you get to the end is to press submit. Otherwise, your responses won't be submitted in.
Thanks, okay. Sandra. What outcome matters most from RSS support? So is it around funding? So is it that support on your application review, your application design? Is it around clinical trials design? Is it around partners and us referring you to partners? Is it around adoption evidence? What would be the most important outcome? And for me, this is really interesting. So which part of the funding application causes the most pain? Is it illustrating your methods? Is it around the finance aspects and your budget? Is it around the plain English requirement at the front of an application? Is it around your research evidence and that being robust? Is it around regulatory advice that you need to include into your application? And kind of moving forward, so obviously this is just a information sharing session to try and get some more information from you as to what would be useful in the future. So if we ran another event with CETA, what would be helpful? Would it be around that PPIE piece, health economics, trials, inclusivity? Would it be around grant application writing? Literally going into detail about a specific funding call? What would be the most helpful? So hopefully people would have finished all of the 6 questions and they'll go into the summary poll.
So we've had 7 responses. And if you've put in a response into the chat, please make sure you put it into the poll.
So 7 out of 21.
Yeah.
So if you're still thinking on it, and as Claire mentioned, make sure it's not in the Q&A in the chat. Literally put it into the poll, as we won't be able to collate them all.
Okay, some of you are saying you can't see the poll. You should have it popped up onto your screen. If you go into the chat, you can click on view poll. And that's for the results. It should have popped up.
Maybe it depends what application people are using.
Yeah.
Like a phone, it might not work on a phone, perhaps. I'm not sure.
Yeah, I'd say it wouldn't work on a mobile. Okay, so yeah. I'm going to draw that to a close, and then if we go into the results, into the view poll, I'm just getting the empty ones. I can't see the results. But just reading through some of the ones in the chat, so evidence, so supporting in your research evidence, yeah, that's definitely something the RSS supports on, and kind of our raison d'etre. Knowing what funding's coming up or available. So because we...
Do you want me to go through the poll results with you, Dawn?
Yeah, no, that'd be great. Thank you.
Yeah. So number one, which was in one word, what is your SME's biggest barrier to getting health and social care funding? People have put complexity, opportunity, evidence, mentorship, foresight of funding.
Thank you. Foresight of funding. So this is a bit of a strange one. So obviously we're not funders, so we won't get foresight of funding because we're not funders. We're funder supports. So it's kind of, the onus is definitely on individuals. So following, so just from kind of a personal point of view, I follow NIHR industry page. So any funding call announcements come out from there. They're promoted on there. For Innovate, so obviously I don't work for Innovate. The RSS doesn't work for Innovate. NIHR works with Innovate, but we're not privy to any funding foresights that are coming out from Innovate. So registering for Innovate newsletter, so they've got a specific funding newsletter, that would be on my list of things to do, and I would definitely be doing that. So even the Gov UK, there's a page there that you can register for notification of government funding. So the onus would be on individuals to locate and track the funding, because that isn't our role. Our role is to support you in terms of creating your research evidence and supporting you on a robust and compelling application.
Okay, number two, which RSS specialist would be most useful to you right now? And people put in trials, design support, and health economics.
Brilliant, thank you. Which are all things that the RSS covers and triages out to specialists within the team. So yeah, that's all stuff that we cover.
All right, number three, in one word, what type of event helps you most? Workshop, one-to-one, 90-minute interactive IRL retreat.
Great. Did out of interest, did anyone dial into the workshop, the Innovation Catalyst workshop, or did anyone attend any of the retreats? Just put your response in the Q&A.
So number four, in one word, what outcome matters most from RSS support? And it was funding, design plan, trial design, evidence, and adoption of the results.
Brilliant. So I'd say probably top on the list would be an application review. So from the enquiries that we get for that, I would say that was definitely top of the list. But it goes back to the point that I made at the beginning. So getting in early so we can help in terms of your research evidence design and making sure that it is cover everything would really, really impact on your success rate in terms of an application submission. And I think it kind of links to the partners issue as well. So because we're embedded into the system, having that signposting across business support and across the health and life sciences social care ecosystem, I'd say that's quite nuanced and specific. So I think, yeah, that's really supportive and helpful.
That's great. So number 5, which part of a grant funding application causes SMEs the most pain? Evidence, budget, commercialisation, impact, and regulatory. So the standard.
Yeah, that would, none of that would surprise me. So regulatory, we do have some regulatory methodologists. So we do signpost out in terms of regulatory, but regulatory advice is really not within our remit, but signposting out and giving you support in terms of where to go, who to go to, how to get support and help, that would be. But cold hard advice on med regs isn't our thing, but yeah, we know who does it and where to go.
So the last poll was, if RSS ran a joint SATA event next quarter, one word for Nigel: focus. Definitely grant application, workshop, trials, matchmaking, funding opportunities, workshop, and so on. So
yeah, brilliant. Yeah, so none of that's
new.
A good shock either. So that's great. Yeah, so I was saying to Claire and Sandra just before we kind of dialed in, so at the moment things are pretty insane with the launch of the Catalyst. So it's all hands to pump in terms of doing application reviews, but looping back to the kind of beginning point of being in the system early, so you're registered with the RSS, so they can help you start designing your application up, so that you're ready to go when a call's announced. And there's some tweak in there, but coming in last minute just for an application review isn't really going to be that helpful and supportive. So yeah, kind of bedding it into your business plan from as early as possible would be really, really recommended. So we can have a discussion. Sandra, Claire and I'll have a look at what would be useful in terms of the feedback, what we could run later in the year, potentially September, when things have kind of quietened down with deadlines for current application calls, and we can look at getting something specific into the diaries for that. Just to note, supporting the Innovation Catalyst retreats and workshop, there's a PPIE webinar on Friday. So I'll actually put that in the chat in a minute. There's a health economics one, which is just hot off the press scheduled, and that's the 2nd of July. The clinical trials and stats ones on the 1st of July. So I put those in the chat, just so you've actually, I haven't got the link for the registrations for the health economics one, but just kind of if you were interested, put a date reminder, and then all of them will be shared. So they'll be shared on the LinkedIn page under NIHR Industry, and the registration links are on there. And I shared them earlier in the week as well. So they're out there. So if you're specifically interested in any of those areas and want to dial into the webinars, then one Friday for PPIE, 2 next week, trials and stats and health economics, and the links are on LinkedIn under the NIHR Industry page, or I've shared them on LinkedIn as well. So obviously feel free to dial into those, even if you didn't attend the workshop or the retreat. Feel free to dial in.
Dawn, to move your slides along, you'll probably need to take control of the slides again.
Well pointed. So this is just to illustrate our place in the overall aspect. So everything we do is around strategy and policy, making sure that we're aligned with it. So aligned to the 10-year plan, aligned to the industry strategy in terms of myself. So if people were curious in terms of NIHR funding and kind of levels of funding, so NIHR is one of the largest investors in health and social care research in Europe. So following the LinkedIn page around funding call announcements, which would come from the NIHR industry team, or it would come from NIHR LinkedIn page. So there's a generic LinkedIn page as well. So check that you're following the right LinkedIn pages, because there's one for the generic one, there's one for industry, there's one for community. So if you're in like the social care space, then I'd suggest following that as well. But just to kind of illustrate the size. So everything we do is around government priorities. And that's why the innovation catalyst, why the calls around hospital to community. So making sure that we're delivering to the priorities. Again, everything we do is around impact, innovation, inclusion and investment. So that's the NIHR 4 I's that all of the programs work to. We also work to the NHS Big Five, so around those key areas in terms of maternity, chronic respiratory, mental illness, early cancer direction, hypertension, case finding as well. So these are the NIHR funding streams. So the ones in red I've highlighted are specifically for industry facing one. So I4I, and under I4I you've got FAST and Project Development Award, PTA, and then the new Innovation Catalyst I've put into there. But colleagues will work across all of the other funding streams. I've just highlighted the red ones because they're the industry facing ones that I work on. So this is just an illustration of research across the innovation pipeline. So you might have noticed if you've looked at the Innovation Catalyst call, so it's uncapped, which is, I don't know, maybe unheard of. I've certainly not seen it in my business support life of, God, making myself old, 30 years. So I haven't seen an uncapped funding stream in my years. So this is just a innovation pipeline and where the funding lands. And I think someone mentioned in the slides, will they be shared afterwards? And yeah, they'll be shared. So all of this information will go out. So this is just kind of a key slide around some stats, what the NIHR RSS has done. So as said, industry is only a part of the RSS piece. So we work very closely with early career researchers, and all of the funding streams I highlighted, other than the industry ones. So these are the 8 hubs. So as said, they're nationally based, regionally based, because they're all based within an HEI, and working with a clinical trials unit. Not all of them work with a clinical trials unit because you've got the specialist centres, but most of them work with a clinical trials unit. So all regionally based because of the HEIs, but they all work to a national piece. So you can go to any hub with specific questions and register with them for support. You don't have to go to one that's within your region. You can go to any. The other nuance in there's King's. So King's specialises in mental health. So that's just an overview of RSS support. So the approval, triage, and how we work with you. So just kind of a recap at the end, what we do. So as mentioned, we do signpost, and we'll go out to partners and stakeholders, whether it's across the innovation piece. So for example, if you're trying to exploit your data, or data's part of your project, a large part of your project, then we work with the National Innovation Centre for Data. We also work with the National Innovation Centre for Ageing. This seems generic, because it's saying regional specific rather, because it's saying Northern Accelerator, because we do work with Northern Accelerator for that whole northern piece. And then also in terms of other regions that are commercialisation teams combined for the HEI, so that's set squared in the south. So in the north we work with Northern Accelerator with the TTO officers or the commercialisation teams from the HEIs. For delivering research, we work with the RDNs, the Health Innovation Networks, the HRCs, Health Tech Research Centres. In terms of commercialisation and business support, BIPC, so if someone wasn't an HEI, then if they weren't aligned to an HEI, so they're not a spin out and academic startup, we work really closely with BIPC, and in fact so close I was there yesterday. So the largest ones in the British Library, so free support around IP, market assessment, etc. The growth hubs, so every region will have a growth hub, and they provide generic business support, not specific to the sector, but they do provide generic support, and we work very closely with them. Startup support organisations, so for example in the Northeast we work with TEDCO, and there are other startup support organisations nationally that you can work with, membership organisations such as CETA, and sector bodies as well. So that's my details. The RSS website links there as well, and that'll come out with the slides for details as well. So in terms of Q&A,
Dawn, there are a few comments in the chat. I don't know if you can you access the chat?
Yeah, I can see the chat now. I've finished my slides, so just I'm not sure how far to go back.
Yeah, if you scroll down, I think starting at Julian Dye at 1:30, and he says another issue is uncertainty about preclinical regulatory requirements. Can you see that one?
Yeah, I can see that one.
Okay.
So in terms of developing a clinical trial strategy, because it is so specialist, that's one of the things that we do within the RSS. So as said, most of the RSSs sit with a clinical trials unit. So most RSS have a co-director model, and one of the co-directors will be the CTU director. So if you need clinical trials support, then we can obviously refer you through to the CTU. And I mentioned the webinar next week on the 1st. So that's specifically around design and clinical trials and stats. So I would suggest dial into that. And in terms of your strategy into the NHS, I would suggest working with the Health Innovation Network around their adoption pathways, and that's their area of specialism. So I would suggest looping into your Health Innovation Network as well. So Charles, I find scope for application seems difficult to assess if my work project is within scope. So for me, it's just really drilling down into the eligibility. The eligibility criteria is so clear, either you're in or you're out. So for every single application, go into the eligibility criteria and check that you are within scope. It's clearly laid out what's eligible and what isn't. In fact, there's kind of slides, what's in and what isn't. So literally go into the eligibility criteria and drill into it. And there's a sub page on every funding call for Innovate do it as well, but specifically NIHR. So under each funding call, there's a sub page for eligibility. So just really go into it. I4I PTA is capped. It is capped. So it depends on the specific call and potentially the TRL level it's aimed at, but I4I is definitely capped. Yeah, sharing slides, frustration, much funding's geared towards regulated medical devices, move towards home-based preventative wellbeing. So that's kind of the whole premise behind the Innovation Catalyst, that it's getting things out into the community. Obviously, that's not saying that things don't need to be regulated. If it is a medical device and it needs to be regulated and it's being used in the community, then that's not going to change. But that home-based preventative community role and focus is the whole reason for the Innovation Catalyst funding call theme. Choose between PTA, Innovation Accelerator for MedTech development. So go to the eligibility, see if you're eligible. For me, what I would be doing if I was an SME innovator, I would be developing draft applications for PTA and Innovation Accelerator. So obviously the calls closed for this round of PTA, that was end of May. Innovation Accelerators open till 14th of July. So it depends which you sat under. So if your medtech product was focused on the community, and it needs to be focused on the community, this isn't about retrofitting any device so that it's community based. It's around something that is community based. It's not just thinking, oh, there's some funding open, I'll shove something in with the hope that it'll be relevant. It has got to be a community based product. Expert support and applications for local government tenders, iron out areas where we fall short. In short, no. So I'd say there's an element of developing your research evidence, and then you would need to tweak it for that specific audience. But we wouldn't be specialists in developing local government tenders. That's not our place. But what we can do is help you with research evidence, and then it would be up to you to make sure that it was nuanced to the local government tender, and that would be kind of your role in that RSS research partnership arrangement agreement. But that we won't have experts that are specialist in local government tenders now. Any more questions?
There's no more in the chat or the Q&A. So I think we're coming to the end of the session. Like we said, the slides will be shared. Sandra will get those out to you along with the feedback form this afternoon. But other than that, thank you everybody for joining us. And obviously, if you've got any questions, you can contact us or contact Dawn directly, and we'll be more than happy to answer any questions that you may have. Thanks everyone. Enjoy the rest of a very hot sunny day. Take care.
Thank you.